No, I was working in my backyard and working with a leaf blower, and I hurt my knee pushing it up a hill. So I went to see an orthopedic doctor, and he indicated that I had arthritis. So about 12 years, I'd say, after the first visit, that's when I really came to the realization that I think surgery had to be an option, because I had a lot of difficulty just doing things that, everybody else had no trouble. So for an example, I couldn't do any kind of running. I couldn't do any kind of hiking. When I got out of bed in the morning, it was very painful. Well, after selecting St. Vincent's, one of the first things that was very helpful for me was they had a seminar for any patients who were go through knee surgery. And that was about 4 weeks before the actual date of the surgery, and it was about a 4-hour session. The seminar, I think, was great because I saw other patients who were going through the same thing, but secondly, to hear from a number of people what to expect as you come into the hospital and what it's going to take, for me was very important and really put my mind at ease, in preparation for the actual surgery. So initially I had the operation, and I would say I was, 3 days in the post-op ward. And they were very helpful. The first day there, they had me standing up, which I couldn't believe, having 2 total knees in. And then the next day I was walking with a walker down the hall. Well, during the post-op phase, we had a joint camp, so where a number of the joint replacement patients would go down to the rehab wing together, and we began our rehab. So it was a good environment because you were coming face to face with other people who were, going through the same surgery as you were. So it was a very welcoming environment. When I went to the rehab wing, I spent a lot of time with the therapists, and I had a lot of individual instruction. And again, it was a wonderful group of people. They knew when to push me, when to back off, and give, the right level of support during the recovery period. Well, I'm about 3 months into the recovery now. I'm able to drive, which is a big positive, and I'm able to, walk without a cane or a walker. So slowly getting back to normal. Well, I'm looking forward to getting back on the golf course with my sons and my brothers. Secondly, I'm looking forward to go out to California to see my son play baseball. He's going to be in his senior at college. And just looking forward to all the normal activities that I wasn't able to do prior to surgery. I couldn't be happier that I chose St. Vincent's. Over the course of my stay here, which was about 2 weeks, I encountered a number of nurses and therapists, and every nurse I met and every therapist I had just showed terrific empathy and wonderful care while I was here. So I couldn't have been happier with the choice that I made. I would certainly recommend to anyone that if they have the choice, they choose St. Vincent's.